Welcome back to Parenting Shrink Wrap. Melissa and Sam here, along with our special guest today, Dr. Susan Zink. Dr. Zink brings over 16 years of expertise as a board-certified adult psychiatrist and is the founder and owner of Elemental Integrative Psychiatry in New Jersey. Her passion is helping women struggling with anxiety, depression, insomnia, or hormonal mood changes related to pregnancy, postpartum, perimenopause, to feel like their best selves again. She's also a mom to 3 daughters, so she brings also the personal perspective of being a parent to her professional work, and how difficult some of these transitions and complex that they are. And today we really want her to kind of help guide us through what happens to women during these changes and how it impacts women as moms. So, Susan, thank you so much for being with us today. We're really looking forward to this conversation.
Hi, thank you so much for having me.
So here's my first question for you. And when when came on as a guest, I was like, oh, integrative psychiatry. So as someone who has healed from some things through a lot of integrative medicine,
Uh-huh.
I was immediately intrigued. Can you share for our listeners and for me what that means? And well, I have a follow-up question after that. But what does integrative psychiatry mean? What's the difference between that and, say, non-integrative or standard psychiatry?
Standard psychiatry. Yeah. Integrative psychiatry basically blends the best of traditional psychiatric treatment, so prescription medicines and psychotherapy, with holistic and evidence-based alternative options. So that can include things like exercise and sleep optimization, nutrition optimization, kind of like food as medicine. Um, Acupuncture, yoga, and also evidence-based natural supplements and botanicals. So I think in general in psychiatry, we should consider kind of the whole person and everything about them. And it's not just about medications and okay, you have this diagnosis and here's this medication. I think in general we should do that, but integrative psychiatry really includes a lot of other potential treatment tools that also treat the whole person.
Thank you. And I imagine that's really comforting for your clients too. There was a Facebook, like a mom's Facebook group just this week actually. And it was not your client base, but it was like my 8-year-old child is behaving like this. We're pretty sure it's ADHD, but we don't want to leave other stones unturned. Does anyone have a provider who would be willing to look at like traditional ADHD diagnosis and treatment, but also like explore other options and treatment plans? So like basically this was a person looking for an integrative psychiatrist for their
Right,
child, right? Like that's really,
right.
they didn't have the word for it, but that's what they were looking for.
Right, exactly. And I think probably that's what most people really want is someone to hear about their whole story and their whole life and their whole um history, and to really take everything into account when you're offering treatment options. And I think a lot of people, whether it's because of the stigma or just personal preference, are hesitant to be on psychiatric medicine. Um, but I think even in cases where people are really interested in integrative options and alternative holistic options, even if you, as a psychiatrist, recommend a prescription medicine, it's probably really helpful to hear that you're also considering other options. It's just probably a little more open-minded and approachable for a lot of people.
So, you know, you specialize in women's health,
Right,
helping women through life transitions, and particularly transitions that are affected by hormonal shifts, it sounds like.
right.
So let's talk perimenopause.
Absolutely.
So what are like when does it happen? What happens in the body when perimenopause takes place, and what happens psychologically? Like what why do we get anxious? Why do I get anxious? Why do I have random heart palpitations and anxiety? That's really what I'm getting at.
All the $64,000 questions. So we'll break it down a little bit. So just first defining perimenopause. What is it? Perimenopause, or the transition to menopause, is when our regular reproductive hormones and cycles start to become more irregular. So normally we have this, typically like in when everything's functioning sort of normally by the textbook, we have these monthly cycles that are very predictable in terms of their rise and fall of mostly estrogen and progesterones. And as we age, that starts to fluctuate and become very unpredictable. And that's what perimenopause is. Menopause is the day after which you have not had a period for 12 months. So everything before that is premenopause, everything after that is postmenopause. But the shift from having regular hormonal fluctuations to having irregular hormonal fluctuations to not having a period is called perimenopause. And that can last for like 7 to 10 years. And the average age of menopause is, I know it's forever. It's a really long time.
What a freaking cruel drug. I mean, it's
Yeah,
the same length of time that puberty lasts for our kids, and it happens at the
exactly.
exact same time in our parenting life too.
That's right.
Yeah,
It's
that's
like
not
a puberty.
nice. That's not
No,
nice.
It's unpuberty. It's the opposite. It's
the
like,
And I'm
opposite.
really unhappy that you just drew that connection of those timelines, because I really don't like that
well,
right now.
because you're not living it yet. Like, it's anyone who's living it knows the connection. That wasn't an aha moment for anyone who's in the thick of it. Like,
I'm not there yet, and I think I'm going to stay in my naive little world of not being there yet.
so
It's good to be prepared.
what happens? Okay, so like progesterone. First of all, what do progesterone and estrogen do for us? Like, why do we need them? Why do we like them?
Great. Yeah, great question. Estrogen and progesterone do a lot. So we can't possibly talk about all the things that they do right now, but in terms of mood and how they affect what's going on in the transition to menopause, estrogen and progesterone act throughout the whole body. So they're not just acting on the reproductive organs and the reproductive cycle. They're very active in the brain. And they're also very protective of mood and sleep. And estrogen also regulates temperature too. So that's kind of like your typical sort of hot flash story of perimenopause is all mediated by estrogen. And so when the levels start to fall or fluctuate, that's why we get hot flashes and night sweats. Um, in terms of mood, estrogen helps to regulate mood and to keep the mood stable and to keep people relatively happy and feeling well. And so when the estrogen drops, that can lead to a lot of depressive symptoms.
Okay.
Progesterone is kind of the calming hormone, so it acts in the same parts of the brain that a lot of medications do to keep people calm and less anxious. So when progesterone drops, then that's when we start to see trouble sleeping and feeling more anxious and more irritable.
There's your answer,
There
Sam.
it is. It's a progesterone problem, but it's also an estrogen problem. I just didn't disclose that on air or earlier in the conversation. It's both.
Yeah, it's both. It's both. And then there's also testosterone, which gives us energy and does a lot of other things too. And that's really important. Also, we don't tend to think of testosterone a lot in women, but testosterone is a precursor for estrogen and it does a lot of other things too. And that's also fluctuating and sometimes dropping very low. And so all of those changes can really affect our energy levels, our sleep quality, our moods, our anxiety levels, the cognition too, our thinking. And so you hear a lot of women in the transition to menopause talking about brain fog or word finding difficulty, like simple words you can't think of, right? Like just a simple the name of something. And
Yeah.
those are really,
A couple weeks ago, I remember vividly trying to come up with the word inspiration. It wasn't like it was a foreign word for me. Like, I just
yeah,
couldn't remember what that word was.
Well, and
right.
Sam, recently I've noticed, and I don't see enough adults, so this isn't my like niche area, but a lot of like perimenopausal and menopausal women questioning whether they have ADHD.
Yep.
They think they have like an attention disorder all of a sudden, or
Oh,
or something because of like the brain fog and the concentration difficulties and like those word finding difficulties. They're like, oh my gosh, like I have this other disorder
Right,
going on, because they're looking for like an explanation to something that is actually hormonally being driven,
right,
but the brain changes that are happening can sometimes look like an ADHD
right.
diagnosis, but it's not actually what's going on, especially if you take a detailed history and find out there really wasn't any of that prior to that age bracket.
Right. Or they did have ADHD and they were able to manage it, and then perimenopause hits and it unmasks all of
Mm-hmm.
these symptoms. And then you combine that with sleeping poorly, um, and all the other responsibilities that happen in midlife. And sometimes there's just too much on your plate. And so you combine it with sleeping poorly and the hormones not supporting you as much as they were. And having to take care of kids or maybe take care of your aging parents at the same time, and there's just too much on your plate. And it feels either like you have ADHD or you do have ADHD, and now all of a sudden it's a lot worse.
So when you see clients at this stage of life as an integrative psychiatrist,
Hmm.
do you go right to like, let's get your hormones checked and let's consider HRT, hormone replacement therapy? Do you say, let's see what we can do with lifestyle? Or are you like, we can only do so much with lifestyle because you are of a certain age and this is going to happen no matter what? Like, this is nature of the beast. Like,
Yeah.
what is your like mindset and framework around treating people this age?
Yeah. It's such a good question, and the answer is complex, right? It's case by case, of
Mhm.
course. So a lot of women who I see already had a pre-existing some kind of pre-existing psychiatric condition like depression or anxiety, and so they're coming to me because they just want to continue treatment, or they're noticing that symptoms are worse. And so it's a multi-pronged approach. So you're considering all of these things. So you're considering, first of all, diagnostic clarity.
Mhm.
Do they have a psychiatric condition? Do they meet criteria for depression or anxiety or ADHD or some other mood disorder or sleep disorder? Um, Taking a really careful sleep history too, because sleep disorders increase hugely in perimenopause, especially sleep apnea. Estrogen and progesterone are also involved in muscle tone, and so when those go down, the muscles in the throat and in the nasopharynx become looser, and that increases the risk for sleep apnea. We see more restless leg syndrome. There are a much higher incidence of sleep disorders in perimenopause. So taking careful history about mood and anxiety symptoms, sleep symptoms, and also, of course, lifestyle symptoms are very important. So having support, social support, if you're a mom and you're taking care of kids and you're in the thick of a career and just kind of doing everything, of course that's going to affect how your mood and your anxiety and sleep are. And then the mood, anxiety, and sleep affect how you manage all of that too. So we're considering all of those things, and there are so many recommendations that we can give to women in this stage. It can kind of become overwhelming. So figuring
Yeah.
out kind of the low hanging fruit first, I think, is really important.
So, like, how do you help it not be overwhelming? You know what I mean? Like, if you've
Hmm.
got a client, you're like, boy,
Well, and
there's a
Sam, they're
lot of
already
layers
coming
to your
in
problem.
feeling overwhelmed,
Yeah.
right? Like
Right.
if they're stepping
Yes,
foot into
exactly.
Susan's office, they're already kind of like, and because like it took all of that to even like step foot and like make
Yeah.
the appointment with her.
Right.
Right.
So you've got
Right.
someone who's like teetering.
Right.
Like,
Right.
it's just like, right? They're like they're on shaky ground to start with. So,
Yeah.
so your approach, I guess what I'm hearing you say is where your starting point is not the same for every client. Like you would start differently based on like severity of symptoms or what's the most problematic thing or what's the
Exactly.
easiest win, right? Like, are these the kind of things
Exactly.
you think about?
Yes, right. So what's the most problematic thing? What's the most bothersome thing? What's the easiest thing we can do to help you with that? And then there's this whole list of things that we'll probably recommend, but we're not going to do them all at once. I might introduce the idea and then I'll say it's kind of like a menu, like pick a couple of things that sound good right now and try those. I mean, I have some people that I just tell, I just want you to go outside for 5 minutes every day right now. Get some sunlight. That's, that's the
Mhm.
thing you're going to do right now. Because even just going outside, getting bright light in the morning is something that can be really helpful. Those people also, maybe they're on medicine, they're on a
Mhm.
prescription medicine for some depression or some anxiety. Um, and I probably will say too that for many of my patients, I will also really focus on sleep because I think sleep is so important for helping everything.
Yeah.
It's important for mood, anxiety, just physical recovery, for concentration, for everything. So I will try to optimize sleep probably for most people, unless they don't have any problems sleeping, of course, but I think most people who I see do have problems sleeping, so I will really try to work on that.
Susan, what do you typically recommend on the sleep front? Because I can only echo what you said about sleep. On the opposite end, when I'm seeing little kids, like I talk about sleep, I feel
Yeah.
like at every
Mm-hmm.
appointment. And I ask about sleep
Yep.
at every appointment.
Mm-hmm.
So
Mm-hmm.
I feel like
Same.
that's like through the ages, like I can't echo enough how important I think
Right.
sleep is. So what are you recommending for women who are kind of perimenopause, postmenopause, like to do on the sleep front? Like what are your big hit recommendations, I guess?
Again, it's going to be case by case. So it depends on what is the problem with sleep, what's keeping you awake. So if it's the hot flashes are waking me up in the middle of the night, then that might be a case where we're going to prioritize getting on menopausal hormone therapy because that
Mm-hmm.
is really the hormone therapy is has the most evidence to help with perimenopausal symptoms out of anything, even of the integrative tools of the alternative holistic supplements. The hormone therapy is can be so helpful for people. Now, it's not helpful for everybody. Not exactly everybody is a candidate, but I would say most women in this age range could be good candidates for menopausal hormone therapy. And so that's one thing is that do we reasonably think that menopausal hormone therapy could help with your symptoms and your sleep? Because progesterone, micronized progesterone, can be very helpful to get people back on track in terms of sleeping, and also combined with transdermal estrogen usually. But then we also want to really carefully diagnose what the sleep problem is because we can't treat it properly without knowing what's causing the problem with sleep. So is there sleep apnea? Do we want to refer for a sleep study and treat sleep apnea if there is any sleep apnea? And then, of course, doing all the behavioral things that we tell people to do for sleep. So, no caffeine late in the day, try to get some movement every day, eating a nutritious diet, um, having a nice bedtime routine. And then also talking about non-pharmacologic sleep management. So, cognitive behavioral therapy for insomnia is kind of the gold standard non-pharmacologic sleep intervention and can be really helpful and is especially helpful for people who don't want to take a sleep medicine, which is really the ideal, is not taking a prescription sleep medicine or even an over-the-counter sleep medication indefinitely.
Yeah, for my therapy clients, because I mean, I see clients of teens and up. So my adult clients in that situation, I will often, and my kids for that matter, I
Yeah,
recommend yoga nidra, which is, like a
yoga is
guided,
great. Yeah.
not twisty bendy yoga. Like this is like sit in your bed,
Yep.
search yoga nidra on YouTube or Spotify, and put
Yes.
your AirPods in, and it's a guided meditation that takes you like it focuses your body focus
Hmm.
your attention around parts of your body, and I almost never make it through one awake. Like it's how
Yeah.
I fall asleep with some
Hmm.
regularity because I need to
Hmm.
turn my brain off.
Yes, right. Yes, exactly. And those are all, I would say, much healthier or preferable interventions to improve sleep quality. If you can sleep without a medication, that's ideal.
Mhm. Can I ask an HRT question?
Sure.
So if someone's in perimenopause and a doctor was like, "Hey, here, you know, progesterone, estrogen, testosterone, whatever, like there's just
Hmm.
deficits in these, and I think it'll help relieve your symptoms." Does taking those prolong perimenopause? Like, or is your body going to
That's a good
is
question.
your body going to shut down when it shuts down because of some predetermined biological point? I
Right.
don't
Not,
know the answer to that. I like,
yeah, not that I know of.
okay.
It's more, uh, that's a good question, and I don't know exactly the answer. I don't want to make up an answer,
Yeah.
but I would imagine that it doesn't. And the things are happening in your brain, and the brain is what controls all the release of the hormones in the rest of the body. So I would think not, but I don't know.
So here's another question, and this is it's an ignorant question. Like I really don't know the answers to these because I'm not a physician. If you're on HRT and you go through menopause,
Mhm.
do you do you stop doing HRT? Are you done then?
That's it. That's the question of the day. And because we had this, so only recently did the FDA remove this boxed warning from menopausal hormone therapy. And so, like when I was in medical school and residency, we were taught that you absolutely can't give hormone replacement to women in midlife because it increases their risk for all these terrible diseases.
Yep.
And so the research sort of stalled on
Yeah.
hormone therapy until recently. And so I don't know that anybody knows the answer to how
Okay.
long you should continue taking hormones. It's probably very case by case now. I don't know that we have a lot of research on how long we should continue to take hormones or how long it's okay to take hormones, especially because the types of hormones that they were using in that women's health initiative study were different than the ones that we use now. And so I don't think there's a good research back answer for how long they should continue. But I think the one thing they do say is that if you start hormones within 10 years of menopause, then we know the risk of all these of breast cancer and stroke and cardiovascular disease, that the risk doesn't go up
Okay.
for if
That
for
was
that.
previously, Sam, like why they said no. So
Right.
there's
Right,
this
But
huge generation of women who just suffered on through
right.
and had no treatment options. Like they would go to their primary care doc, their OBGYN, like a psychiatrist, and it was just like, sorry, there's nothing we can do for
I
you.
Right.
remember hearing about that because the study, and I can't remember what the stats were, but like the study looked at some sort of, there was an increased risk, but when you zoomed out, the increased risk was like point nothing, right? It was like, or, I mean, I'm making that up, but it was like,
Yeah, it was small.
it was really, really small, and it was
And it wasn't
specific to a
controlled
certain
correctly. Like it
population,
was
right?
the control factor and
Yep.
like
Yeah.
The
so
population was different. It was women who were really postmenopausal, and they were giving different. It wasn't. They weren't giving bioidentical
Uh,
hormone therapy, so it was a different. It was just a completely different population and different medications than what we're using now, and we haven't really studied in a long time giving the types of hormones that we're giving now and how long they should continue. So I think it's case by case depending on the woman. And I think I've heard some women say, absolutely not. You can pry my hormone therapy out of my cold dead hands, and
that's
I'm going to stay
exactly
on
what I
this
was
forever.
thinking.
So
It's totally. I was on the sidelines of my daughter's field hockey game several months ago, and some like I overheard these women, and of course interjected myself into this conversation. They were like parents of my kids' teammates. They were talking about, and like one was like touching her hip where her estrogen patch was, and she was like, I will not do without my patch. Like
just making sure it's still there.
it was like this thing, like I mean, because that like that's where it goes on your like
Right.
lower abdomen, right? So she's but like it was this fondness for life that the estrogen had
Restored.
reexhibited.
Yeah.
Yeah, exactly.
Yeah. 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 I get that.
so Susan, what do you typically recommend? Like obviously we're all going to hit that age bracket, so now I'm not there yet. So do you make preemptive recommendations to women who haven't hit perimenopause yet, but like obviously like this is gonna happen, like I can't avoid this, I want to avoid it, but I can't avoid this.
Yeah. Right. Well, you might be able to if you start your hormone.
Like do you like kind of like when you're maybe you're seeing a patient for like anxiety and depression, like you're seeing a female patient, but like they're kind of nearing that age, like where like, hey, like this is kind of coming down the pipeline. Like, how old was your mom when they hit
Hmm.
menopause and stuff like that? Like, have you kind of shifted your recommendations to those women to be like, hey, like you may want to consider getting on HRT now before any of this even starts? Like, is that where recommendations are going? Like, this isn't my area of expertise in psych.
Yeah,
So,
that's a great point and a great question. And I don't know that I would recommend starting hormone therapy before they're symptomatic. I probably would recommend, or not recommend, but just educate and say, you're, maybe you're almost 40 years old, and these are the types of changes that you can expect. I think a lot of women don't even know that they can be perimenopausal when they're in their late 30s and early 40s. And so educating about what might happen can be
mhm.
helpful, and giving them that preparation so that they can recognize, oh yeah, this is what you talked about. This might be what's happening, so that they can get help faster and they're not wondering why you can't remember the word inspiration all of a sudden, or why you're suddenly ragey all the time, and it seems to come out of nowhere. So just giving them that mental preparation for this might happen, although also saying it's not guaranteed to happen, but this might happen. You might notice this, and we can treat it. So it's reassuring also.
For the sake of our listeners, Susan, what would you say are like the top hit things that women should kind of keep an eye out for that are in their late 30s, early 40s, like they're in that age bracket before perimenopause has truly technically hit?
Going back to sleep, any sudden changes in sleep and persistent changes. Everybody has trouble sleeping sometimes, but if you're noticing all of a sudden in your late 30s that you're waking up sweating and you've never had that problem before, you might recognize that that's a symptom and just something to keep an eye on. If you're noticing that you're not, maybe not performing well, if you're noticing your functioning changing, like you're not doing as well at work, or you are having more problems with your relationships, or you're snapping a lot, those I think are things that are easy changes to recognize and to look out for.
What I'm taking away from this episode is that if this is happening, you don't need to suffer through it.
Exactly.
Like, there are ways to help you.
Absolutely. There are ways to help. And now, especially now, because we've had that box warning removed from the hormone therapy, it probably feels so much better. I know some doctors have been giving hormone therapy despite the box warning, but now it probably just feels like the floodgates are open. And so there is definitely help. You don't have to suffer through it. There are a lot of approaches and a lot of interventions that can be very helpful, so that you can not just white knuckle your way through 7 or 10 years until everything stops
Until your marriage
and
crumbles and you hate your life and you just
Well,
can't
lose
remember
your
a
job.
and
thing.
I'm
Like,
thinking like how do you be like if this is happening and it's kind of like somewhat out of a woman's control, like it's hard to be present as a spouse, as a parent, like if all of these things are kind of happening and probably what feels like a random like unwanted
Yeah,
thing.
nobody's delighted by this. That's just true.
No.
Like when you get
nobody.
your period, there's people who are like, "Oh crap, this is awful," but there's other people who are like, "Yay, I'm a woman!" Like there's some beauty to it. Nobody's
Like
like,
Sam, you're losing your period when if you have a teenage daughter is getting their period.
I know, yeah. What the hell,
Yeah,
Like
right?
weird.
that is just like some sick joke. I'm sorry.
Yeah, yeah.
Yeah, I think it's really just important to almost give women in this stage of life permission to take care of themselves.
Mm.
That's number one. You have to take care of yourself first. You can't, there are so many things that we take care of at this stage in our lives, and you can't take care of anything if you're not taking care of yourself. So you have to fill your cup up first before you pour it into others. And that might be taking more time for yourself, sleeping more, finding time to do whatever exercise or movement is helpful for you, going to your doctor's appointments, doing therapy, whatever it is that helps support you, because you can't support anyone else if you're not doing well.
True story.
I
True
think that's
story.
such an amazing, good point.
Yeah,
For people
and
in all stages of life, but
Yes, right.
particularly when
Yeah,
there's these transitional stages like this, that it becomes even more important.
couldn't
yeah,
agree more.
definitely.
Dr. Susan Zink, where can our listeners find you?
Thank you. Yes, I have a private practice in South Jersey and Linwood, New Jersey. It's called Elemental Integrative Psychiatry. So I offer in-person services in that office. I also offer telehealth to throughout New Jersey and to Florida and pretty soon to Texas also.
Wonderful. Well, and all of that will be in the show notes for anyone who wasn't, didn't have a pad of paper while she was scrabbling that off.
Yeah.
Thank you so much for joining us. Thank you for this, like optimism giving, hope providing conversation, really.
You're welcome.
As someone who's walking through this right now, I have been really lucky to have encountered doctors who can help me. And it's nice to know the conversations. It's nice to be equipped with knowledge when you walk into your doctor's office, like, hey, this is what I understand to be the case. These are the possibilities, help me get there. Right. And so I'm
Right.
hoping that this conversation inspires our listeners to take care of themselves, like you said.
Me too.
So, and listeners, thank you so much for tuning in, for listening to another episode of Parenting Shrink Wrapped. Thank you for raising the next generation of world changers. We love you. We love your kids. Thanks for joining us on this wild ride called parenthood here at Parenting Shrink Wrapped. We hope today's episode gave you some useful tools and maybe even a few laughs to help you navigate the twists and turns of raising teens and kids.
Remember, parenting is a journey, not a destination. And no matter where you are on the road, we're here to help you stay on course. Whether it's monumental meltdowns, teenage turmoil, or just the everyday chaos, you don't have to travel this path alone.
So until next time, keep your seatbelt fastened, your sense of humor intact, and your eyes on the road. We'll be back soon with more compassionate conversations and practical strategies to support you and your family.
Don't forget to subscribe to Parenting Shrink Wrapped wherever you get your podcasts so you never miss an episode. And if you've enjoyed today's show, we'd love it if you'd leave us a review and share it with a friend.
If you have suggestions for topics you'd like to see us cover in the future, feel free to send us an email at parentingshrinkwrapped@gmail.com.
Until we meet again, take care and enjoy the ride.